So, you people know what? Tell me what you know about spina bifida.
Spina bifida. The spine is become out the column. Spine near.
Okay, spina bifida. Okay, basically we have two types: spina bifida occulta, spina bifida cystica. In spina bifida occulta, okay, the meninges, CSF, spinal cord is not affected. Only the vertebral arches will fail to fuse. In spina bifida cystica, there are two types. One is meningocele and myomengocele. In meningocele, the meninges and CSF will be out. Spinal cord will be inside, it is not affected. In myomengocele, spinal cord is out plus meninges and CSF will be out. Understand what I am talking? So basically, the common type is spina bifida cystica. Usually it happens at the lumbosacral area and the thoracic region. Okay. Basically, because of this sac, the spinal cord is getting involved. Because of the involvement of the spinal cord, okay, there will be flaccid paralysis of the lower limbs. Sensory problems will be there. Okay. Bowel and bladder problems will be there. The patient can get CTV, clubfoot. Okay. The patient can get scoliosis, kyphosis. Okay. Osteoporotic changes can happen. Fractures can happen. The kid can get hydrocephalus. Okay. The kid can get hip subluxation, dislocation, fractures. Okay. These are some of the important clinical manifestations for spina bifida. Understand what I am talking? So, as soon as the baby is born, there will be a sac. Okay. That is nothing but myomengocele. Okay. This sac, they will get operated within first 48 hours. Within 2 to 3 days, they will make sure that the sac has been removed and they're closed. Okay. And one of the important things you should understand in spina bifida is, depending upon the level of involvement, okay, your lower limb muscles will get involved. For example, if the sac is at the thoracic region, okay, so from trunk all the muscles will get paralyzed. If the sac is at lower level, some of the hip muscles will get spared. Okay, so it is nothing but it is one kind of congenital spinal cord injury. Understood what I am talking?
Yes.
Okay. Once the sac has been closed, okay, so what is the important aim of our physical therapy is that, okay, the kid should be all the time, okay, should be in prone line, or the kid should be sideline. The kid should not be supine line. Okay, one of the important thing. In most of the spina bifida cases, our important aim is to prevent deformities, to maintain range of motion, and to take the skin care, because sensory loss will be there because of spinal cord damage. Understood what I am talking? So one of the important things you should start with passive movements. You should teach the patient passive movements for the hip joint, for all hip adduction, abduction, flexion, extension, internal rotation, external rotation, knee flexion, extension, ankle plantar flexion, dorsiflexion, inversion, eversion, okay, mobilizing the metatarsals and stretching the toe flexors and extensors. All those things we should teach the patient. Okay, so the range of motion maintenance is very, very important, and you have to prevent the deformities. For preventing the deformities, we can use splints at the night. Okay, so one of the important things you should understand is that upper limbs will be normal, both upper limbs, head will be normal, and the trunk will be normal. Only the lower limbs will be involved in spina bifida patients. Okay, so